Hey, this is Teddy Burriss. I got my good friend Doug Heckinger with Pelotonics with me. And he and I were talking earlier and said, you know what? I said, Doug, this would be a great conversation for us to share with your clients and with people who have this problem. And the problem is group health costs are skyrocketing. So Doug, group health cost, what is this? And why is it such a problem to employers?
So yeah, it's the group health plans that are sponsored by employers.
Yep.
The problem is it has become the second largest cost just behind payroll.
For all employers.
For all employers, right.
Yeah, yeah. So why is this spiraling? I mean, I got the basics, but why is this spiraling health cost issue such a big problem for employers today?
Well, what it's causing is it's preventing employers from being able to attract qualified employees and to be able to keep employees. And when they do offer a plan, it's burdensome to the family to add, for the employee to add dependents on.
Yeah. And you told me earlier when we were talking that one of the ways that employers are trying to, stymie or deal with that cost issue is they just let the insurance companies create higher and higher deductibles that the employee has to accept.
Right. Yeah.
That's got to be tough. So there's a lot of reasons why health prices, and I'm being careful my word here based on the conversation you and I had, why healthcare prices are going up. One of the things that you told me that a group had done some research on is that there was nearly $1 trillion in waste related to healthcare, and that there's estimates of $300 billion in fraud. Talk about that a little bit.
Right. So because the system is so complex, there's a lot of room for error and even failure of care coordination between doctors, overtreatment, rushing, care being rushed by lack of coordination, then fraudulent billing, and even deceitful practices and unscrupulous tactics.
And those costs have to be covered, and that just keeps pushing the cost up higher and higher for everybody. Oh, excuse me, Doug, I used the wrong word. It keeps pushing the price up.
Right. Yeah, we distinguish between cost and price.
Yeah.
Cost having been pretty stable for the last decade or two.
Oh, healthcare costs have not really risen, but the prices are.
That's correct.
What's causing that besides waste and greed?
Except for a few specialty pharmaceuticals, the cost to deliver services has been basically flat, and clinicians, the doctors, are only getting 27 cents of every dollar that's being charged.
Huh. Yeah. And so the rest of that money is going out to lots of other groups who want to be a part of making money off of healthcare.
If you will, the middleman bloat.
Yeah. And what's the term you use for the manager of medical costs? What was that term you used earlier?
Pharmacy benefit managers.
Yeah. Oh, talk a little bit about how that. What's causing what's happening there that's causing prices to go up?
Well, we have a chart that if you could understand the terminology of all the hidden fees, it would anger you. All the hidden fees that these pharmacy benefit managers throw in there to increase their profits when it's not truly legitimate cost to them. Yeah. All
right. So, I mean, we as individuals, we as employers don't have the ability to solve all these problems, but let's talk a little bit about what we could do. So what should we be doing individually as well as employers? First and foremost, what should we be doing?
Asking questions, not necessarily taking the word of somebody who is representing an insurance company. You need to talk to an independent consultant that has no vested interest in that particular insurance company or whose income and fees are not based on bonuses from these insurance companies.
Gotcha. Now, so this is one of the ways that Pelotonics comes to the picture.
That's
So
correct.
talk a little bit about what Pelotonics does in regards to helping employers deal with group health care calls and how you help them manage this.
Well, very simply, we are consultants hired by the employer. We get paid on a percentage of their savings or on a flat per employee per month fee. So they know all the costs, they know all what they're paying us. There's nothing hidden.
Yeah. So you help the employer find the insurance companies who do more transparent fees. Is that right?
That is correct. They know where their money is going.
Yeah.
They can get all the data that they want to analyze what their annual expenses are. They're not banging their heads when they call the insurance company to get all the information.
Yeah, yeah, and they're not, what's it called? Making decisions with only a little bit of the information.
Yeah, we want them to have it all.
Yeah. So, Doug, when you and I were talking about this really, and we've talked about it a few different times, this whole conversation about, transparency, about group health costs and the whole conversation about price and cost. And and over the last 6-8 months, you and I have been talking. I'm really more impressed about what Pelotonics has the ability to do to help these employers to be able to come up with the best solutions that work for their employees. What's the easiest way for me to tell people to get a hold of you, Doug?
The best thing to do is to call us or text us. Don't email us. It'll get lost in the shuffle.
Yeah, yeah. I'll make sure that in this video, I make your phone number available for everybody to see. So, Doug, thanks a lot for sharing this. Thanks a lot for all you're doing to help employers in this challenge. And let's plan on having this conversation again soon.
Sounds good. My pleasure.